Welcome back. With no access to vaccines at the moment, we are staring down the barrel of a long winter. And with the cold weather pushing us indoors, we need to focus on staying safe. That's why today we're giving you an indoor risk guide, and we've called upon an infectious disease expert to help us out. Dr. Zain Chagla joins us now. Welcome, Dr. Chagla.
Hi, thanks for having me.
Thanks for being here. Listen, we know numbers are rising right across the country, and I think most of us are reevaluating exactly how we can best keep ourselves safe. So let's start with talking about schools. What can students and parents and teachers do to ensure the best chance at being safe all day, being in school all day?
Yeah, I mean, there's different jurisdictions, different rules, but I think that the general principles that have been throughout the school experience has been what happens in the community happens in the school. And places where there's high degrees of
Mhm.
community transmission, unfortunately, have children showing up in schools positive. Places with low transmission seem to be more protected. So I think we realize with everything, schools need to remain open for as long as possible. Masking children, particularly the older children, is helpful. Making sure that kids are screened every day for symptoms, asked as appropriately and as in depth as possible for symptoms, as it's not only the duty of parents to protect their own children, but it's the duty of parents to protect other children, and keeping kids home and testing them if needed. And then finally, some schools are looking at innovative strategies. The city of Toronto is starting to open up windows in classrooms without great ventilation, which is
Huh.
pretty cheap and easy and really just requires a little bit of bundling up, but could have some significant effects on trying to ventilate those musty classrooms.
Let's talk stores because depending on where you are in Canada, there are retail closures. Here in Ontario, there has been, quite a bit of criticism of the government keeping
Mm.
the big box stores open but closing smaller businesses. So what's the risk level when it comes to shopping, and does it depend on the size of the store?
Yeah, it's a good question. Certainly the things that lead to COVID transmission are indoor spaces, poor ventilation, lots of contacts, poor masking, and that can happen in a big store or a small store. The bigger stores do have the benefit of having more space, having limited capacity, and spacing people out. But obviously, that could go wrong, and so people should make that choice if they go into an establishment that's open, that is very crowded, where people aren't adhering to public health measures. They have the choice to leave that establishment and not put themselves at risk. The little stores, if they can minimize capacity, are at a similar risk. But remember, these are little establishments. They're often in places where ventilation is poor, and so there certainly is still risk incorporated
Mm.
with that. It's a trade-off, and I think we also have to look at how this impacts society more than just which stores can open and which stores close.
Let's talk about gyms. Are there certain gyms that are safer, and are there certain exercises that are safer than others? And should we all be wearing a mask when we're exercising?
So we've had transmission in fitness classes and gyms. There's been a class in my own city in a cycling studio. There's been a cycling studio in Calgary. There's been a yoga class in British Columbia, all of which that have had cases associated with the classes. You have people indoors that are cramped and breathing hard, and so those create the conditions that really do transmit COVID, even though it's something that's supposed to be helping our bodies. First of all, same principles apply. Look at your classroom, look at how they're screening people coming in, look at the crowding within those classrooms. Many places recommend but don't require masks. And I would actually really recommend this for people. It's uncomfortable, it may not feel great. There's really good data to suggest that your training, your oxygenation, your ability to exercise isn't impaired by a mask. A big study that was done by Saskatchewan,
Hmm.
and so to add an extra level of protection, particularly with that heavy breathing, which is such of a risk factor, I would suggest people do use that. And similarly, look at the ventilation, look at contact tracing and how people are tracked within the building. Those are the
Hmm.
things you really want to look for when you're going to an establishment.
Well, restaurants have been hammered by the forced closures, but they aren't closed everywhere. So, what should we consider before dining indoors or outdoors?
Yeah, I mean, I think one of the biggest themes across Canada is limiting things to your household. And in restaurants are no different in that sense. If you're going to go dine indoors with five people that you are from five different households, whether or not that's within your own house or at a restaurant, this risk is similar. And so, really, going to a restaurant should be an experience by a single household, not necessarily experienced by multiple households. Outdoor
Mhm.
dining is a little bit safer than indoor dining. So if that's an option, if you're in an area in Canada that can tolerate outdoor dining, that's fine. And indoor dining, if you're going with your household, you're limiting the number of times you go in. There's still a slightly higher risk. Using the mask for going to common areas or in and out rather than right at the table is also important. And really just limiting the amount of times you do it if you're able to. Every time you go, there's a slightly higher risk. As rates get higher, the ability to contact trace in those establishments gets much more difficult. And so the least number of times to go is fine. If it's a single special event with your household, I think that's a reasonable risk to take, though, for some people.
Mhm.
Hopefully, we are all following public health advice when it comes to limiting our social bubbles. But can you make it crystal clear what it means to have a social bubble and what kinds of questions that we should be asking the people who are in our
Yes.
bubbles?
Yeah, absolutely. I mean, I think, the concept of the bubble at the beginning was a group of people that had very minimal risk that could interact closely together. And we were thinking about this in March, April, May, where with the lockdown, everything going on, schools closed, people were able to actually contract together and make those groups. The problem is now is we've really gone back into society. There are people that can work from home, but kids have to go to school. People are in workplaces. There's the need to get errands, run groceries, that type of thing. And so, all of those things increase the risk significantly. I think if you're in a public facing specialty, or again, you have a child in school, the bubble concept really does break down. There's too many contacts of contacts, and then that those 10 people or five people that are very close, they share the risk amongst them in that sense. So realistically, the bubble concept still works to a group of people that are relatively not going out much, that are staying enclosed, that kids aren't in schools, that people don't have public facing workplaces. But for the most part, for families with children in schools and people that have normal workplaces, this is probably a concept that can't be applied anymore.
So, as we mentioned at the top, we're seeing these numbers surging across the country. Do you believe that we're actually going to see, like, is it even possible to see those numbers go down during the winter months?
Mm.
Yeah, yeah. I mean, there certainly are things held against us in the winter months. People are indoors more, and hopefully people get out. But behavior does take people in. People have the holidays. People have congregating events. But at the same time, remember this all started off in the winter time last year, and we were able to get things under control through that time. And there's been good case examples where a collective effort by the community even in Canada, has led to a significant drop in transmission in the second wave. I used the example of Ottawa, which is, a place that was seeing fairly high rates in September, underwent that stage two lockdown, really restricted indoor dining, and came out of it not
Mhm.
perfect, but certainly with much better control in their community. So there certainly is hope. There's the restrictions in place, but their own personal lives that we just have to look at minimizing those indoor contacts in order to help with the public health good.
Dr. Chagla, thank you so much for joining us today. You answered a lot of our questions.
No problem. Thanks for having me.
We'll be right back.